righty, it's time to take a talk with Joe Sweithofer, the Brian Insurance guy. Right here on your Cornelius Custom Service at 8 o'clock hour. Window tinting, audio, video, truck accessories, all available for you. All you got to do is go by and see them. They also have layaway available. So go by and check it out today at Cornelius Custom Services, 617 Supply Street, 549-5841, the number. All right, time to talk to Joe, the Brian Insurance guy. And I think something that is probably on the it's always in the news. It's always something you got to deal with when you've got to be at the doctor, the hospital, or something like that, is the major, and I'm talking confusion of healthcare today.
Boy, it is confusing. It's one of those things that has just been launched into our forefront. It's kind of on the news, in the papers every couple of weeks. There's always something going on, and we're actually in the middle of open enrollment. You know, years ago, you would be able to, as an individual, kind of get a health care plan whenever you wanted to. You could get an individual plan, just there weren't real restrictions on when you could do that. You go through the underwriting process and you get a plan. Well, obviously a couple of years ago with the PPACA, that changed. They've now patterned individual health care after Medicare, and so you have open enrollment times where you can get it. Outside of open enrollment times, you have to have a qualifying life event. So we're in open enrollment right now, which started November 15th is when the new pricing came out for the 2015 plans, and it'll run up through February. So what we're staring at now, we've got about another week or so until December 15th, when the time limit ends to sign up for a plan effective 1/1/15. And so we've had a lot of calls. We've had clients that, in the past, you had a plan, for example, that ran 6/1 to 6/1. Well, all of that, of course, has changed as well. And so now your plans run whenever you start it to 12/31 of the end of the year. And next year you start a new plan. So effectively everybody's plan starts 1/1/15. So we got the renewal pricing out. In Young County, we're a little bit limited in that we only have a few companies that offer plans to us, Blue Cross Blue Shield being the predominant one. Blue Cross has got, I think I'd heard a week or so ago, about 68 to 70% of the market share of plans in Texas. And, here in Young County, like I said, we're limited in what we can go with. Anytime anybody sits down and says, hey, I need a health plan, what should I be looking at? I'm always going to show them a PPO. You got your PPOs, you got your HMOs. A couple other plans out there call the HMOs a different thing, whether it's a POS or, a choice network for some of them. But essentially, you're going to look at PPO and HMO. And, unfortunately, the HMOs, where they used to be pretty dominant, now you're finding a lot of doctors just not taking that plan, and that's a contract basically between the healthcare companies and the doctors, how the doctors get reimbursed for care and services and things like that. So the PPO is pretty much widely taken. I know most, if not all, doctors in town take most of your PPOs. The fun part, or the aggravating part as an agent, I guess, is you've got, for example, we'll look at, not to pick on a company, but we'll look at like Aetna, for example. This year in Texas, every school employee on the TRS system went to Aetna. They had been on Blue Cross for years. TRS actually took an Aetna plan this year. And so, all the hospitals and doctors in town, they all take Aetna PPO, no problem. But as the individual consumer, you do not have the capability of buying an individual Aetna PPO plan here in Young County. So while, when you go to the grocery store and you've got, 5, 6 different kinds of milk you can choose from, or, Pop-Tarts or whatever, it kind of got limited down for us. We've got Blue Cross on a PPO basis. You've got, you can get a United Healthcare plan here, but it's not really a PPO, so I really wouldn't recommend it. And so what I try to do when clients come to me, and when my current clients come and prospects come and say, hey, what do I need? Kind of help me walk through this. The first thing we're going to do is try to evaluate, hey, would you be able to get like an income tax credit? Meaning, depending on the size of your household, depending on how much annual income your household brings in, you may be eligible to get, raw numbers here. If your plan costs $500 a month, you may be eligible for $250 of that towards a tax credit, so that you actually end up only paying $250. So we first try to determine, hey, are you eligible for that? And it's not really a difficult process to do. I will say that going to some websites that end in .gov can be cumbersome. But, I'm kind of used to dealing with it, so it's not that big of a deal. And then we just kind of pick the plan, what's going to be best for you. I was talking to 2 different clients yesterday. One of them, gentleman didn't really go to the doctor that often. Maybe went once or twice a year, wasn't really on any prescriptions, didn't really, take anything for medication wise. And I said, hey, they've got plans, for example, where it's got a real high deductible, like a $6,000 deductible. And you pay cash out of pocket until you hit that $6,000. Once you hit the $6,000, the plan picks up everything else. Some folks say, "Oh my gosh, $6,000." Well, let's evaluate that though. How much does it cost to go see a doctor paying the cash price? Anywhere from $120 to $150, $160, depending on where you go. And then, let's just say you get the obligatory sinus infection because the cedars get going crazy, and you got to go see, I'll shoot a plug for my doctor. You got to go see Dr. Lucas. And he says, hey, you know what? Yeah, you got a sinus infection. I'm going to give you, some amoxicillin or something like that. You go to the pharmacy, you pick that up. That's not going to be that much. So you look at, hey, if I really only go to the doctor twice a year, maybe get a generic script every now and then, maybe I'm out of pocket $400 or $500 for the whole year. That $6,000 is basically a stopgap in case the worst happens, i.e. you get diagnosed with something, or hey, you got to go get a bunch of tests run. Yeah, I'll pay $6,000 to not have to pay $80, $90, $100, $150,000 to get a bunch of tests run. So it's all individual when it comes to health plans. We got to sit down, take a look at kind of what's your history, what kind of things do you have coming up, and let's just find a plan that's going to fit for you. Both, economically, what you guys can afford, see if there's some tax credits that are out there for you that you may be able to qualify for based on income, and just kind of, there's no one size fits all.
Yeah, the thing about with health insurance is it's pretty much based on the individual.
Yep.
I know that in the past, with health issues you got to deal with, you're going to be paying this compared to somebody that doesn't have as many health issues. You're going to be paying this, So, the thing is, it's like putting on a pair of shoes. Everybody's got different kind of tastes and different kind of sizes, so they really got to just talk to somebody and find out what they got to get.
Well, you really hit the nail on the head there, Rick. Years past, everything was underwritten. And so you would go in and you'd fill out an application and you'd say, hey, I got these ailments, I got A, B, and C. And they'd say, okay, we're going to go check, medical history, the MIB that actually exists. They're going to go check the MIB and see kind of what doctors have reported for you and say, okay, we have this. We think you're going to, have these issues going forward. Therefore, we're going to rate you at X. All that's been taken out the window. There is no underwriting anymore. You could have, been diagnosed with cancer, diabetes, and you're going to need your arm chopped off and open heart surgery next week. Okay. Sign up. The only qualifiers these days are what's your age and are you a smoker or a non-smoker, male or female, but that's not really a qualifier. And so, yeah, that's pretty much it. You get a plan, and the guy that's healthy as a horse that's probably never going to have any issues ever is rated at the same guy that's going to have open heart surgery next week. They're all rated at the same price. And so no more underwriting, no more pre-existing conditions. That's the thing. They don't turn you down. That's the beauty of it all, and everybody kind of pays the same price.
Right. So, if you got any questions about this, because health insurance is something that you can't live without, so you need to talk to somebody to see how you can afford it and how you can fit your needs. Now, if they get a hold of you and talk to you about these issues, I know there's numbers and all kinds of stuff.
Oh, yeah, 549-2525. Call and talk to myself. I'm extension 23. You can also come on up to the second floor of the Sierra Bank building. Come on in and see if you can set a time where we've been fielding quite a bit of phone calls, handling quite a bit of clients with healthcare. So may need to make an appointment, but appointments are kind of all over the board. Insurance, like many things, is a 24/7 thing these days. And so if it's after hours, if it's not 5:30, 6 o'clock, 7 till you get home, and you need somebody to kind of walk you through this, hey, give me a call. Let's set up a time. I'll be more than happy to go over it with you over the phone. We can Skype, we can video call, all that kind of stuff, and let's just make sure we get you covered the way you need to be.
Call them today at 549-2525, and they're going to take care of you. Joe, appreciate your time, my friend.
Thank you, Rick.
Stay tuned. We got more coming up here on your Cornelius Custom Services 8 o'clock hour.